Have you ever stepped out of the shower feeling fresh and clean, only to notice later that there's irritation or discomfort in a spot you barely think about? After 70, the body can change in quiet, surprising ways, and the hygiene habits that worked for years may not protect you the same way anymore. In this video, we'll walk through 3 commonly overlooked body areas that deserve daily care as you age, and how ignoring them can lead to rashes, infections, and problems that can become serious if they're allowed to linger. Stay with us until the end, because there's one surprising area many people forget that may quietly affect your immune system and overall well-being. Knowing this can change how you feel day after day. Before we begin, I would appreciate it if you like this video, you can help me continue to share these lessons about aging well. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. If you like this video, please comment number 1. If you don't like it, comment number 0 so I can make a better video for you. Now, let's get started. Part 1. The feet, your foundation for health. Your feet are the unsung heroes of everyday life. They carry your full weight, help you balance, and keep you moving from room to room, from errands to family visits. They support your mobility and independence, yet many adults over 70 treat foot care as an afterthought, giving them a quick rinse and assuming that's enough. As we age, that simple oversight can lead to bigger consequences than most people realize. Foot care isn't just about comfort. It's about protecting your health, preserving your independence, and maintaining your quality of life. The feet are often among the first places where aging and chronic conditions show up, and small problems can snowball quickly when circulation, skin strength, and immune function aren't what they used to be. Why foot care matters more with age. With aging, circulation often slows, meaning less blood flow reaches the extremities. That can delay healing, even from minor cuts or blisters. The skin on the feet also becomes thinner, drier, and less resilient, losing some of its natural moisture barrier. When dryness sets in, cracks and fissures can form. They may look harmless, but they can open the door to bacteria and fungi. At the same time, the immune system tends to weaken with age, so the body may not fight infection as efficiently as it once did. For anyone living with diabetes, peripheral artery disease, or neuropathy, the stakes are even higher. Diabetes can damage nerves and reduce sensation, so a cut, blister, or infection may go unnoticed until it becomes advanced. Poor circulation, which is common in diabetes and vascular conditions, makes healing harder and increases the risk of complications like ulcers and, in severe cases, amputation. Even without chronic illness, neglected foot hygiene can lead to pain, stiffness, and mobility problems that gradually chip away at independence. Common foot problems and their consequences. One of the most common issues for older adults is fungal infection, such as athlete's foot. The warm, moist space between toes, combined with thinner skin, can become an ideal breeding ground for fungi. What begins as mild itching, redness, scaling, or peeling can progress if it's ignored. In some cases, untreated athlete's foot can lead to bacterial infections like cellulitis, which can cause swelling, redness, and pain, and may require strong antibiotics or even hospitalization. Dry skin is another common issue, and it's far more than a cosmetic concern. When the heels or soles become extremely dry, the skin can crack and form painful fissures. Those cracks can bleed, become inflamed, and invite infection. For someone with diabetes or poor circulation, even a small sore can become dangerous if it deepens or becomes infected. Consider George, a 75-year-old retired shop teacher who spent decades on his feet. After retirement, he noticed increasing dryness on his heels and mild redness between his toes, with occasional itching. He assumed it was just normal aging and brushed it off. Within a month, a small crack on his heel turned into a painful ulcer that wouldn't heal. His doctor diagnosed a bacterial infection that started with untreated dryness. George needed antibiotics and supportive footwear to reduce pressure and help healing. His story is a clear reminder that small foot problems deserve early attention. A proactive foot care routine. Healthy feet come from a simple daily habit built around inspection, gentle cleaning, and smart protection. Start with daily inspection. Make it routine to look at your feet each day, either in the morning or before bed. Use good lighting, and if needed, a magnifying mirror. Check for redness, swelling, dryness, cracks, blisters, cuts, or changes in color or texture. Pay special attention to the spaces between your toes, the heels, and the soles. If seeing or reaching your feet is difficult, ask a caregiver, family member, or trusted friend to help. Catching changes early can prevent minor issues from turning into major ones. Next is thorough cleaning. Washing your feet should be more than a quick rinse. Use warm, not hot, water and a mild, fragrance-free soap. Harsh soaps and heavily scented products can strip natural oils and worsen dryness. Gently clean the entire foot, including between the toes, around the nails, and along the soles, using your hands or a soft cloth. If mobility is limited, a long-handled brush or a foot washing tool can make this easier. Rinse well so no soap residue remains, because leftover soap can irritate the skin. Then comes complete drying, which is just as important as washing. Moisture left between the toes can quickly encourage fungal growth. Use a clean, soft towel and pat the feet dry, taking extra time between each toe. If reaching is hard, a long-handled towel can help, or a hairdryer on a cool setting held at a safe distance. The goal is simple: don't leave the feet damp. After drying, moisturize with care. Apply a fragrance-free, non-greasy moisturizer to the tops and soles to keep the skin soft and prevent cracking. Products with ingredients like urea, glycerin, or hyaluronic acid can help hold moisture. Avoid applying moisturizer between the toes, because trapped moisture can encourage fungal growth. If you're unsure what product fits your needs, a doctor or pharmacist can offer guidance. Footwear and socks matter too. Choose shoes that fit well, provide support, and allow your feet to breathe. Avoid shoes that pinch or rub, because they can cause blisters, calluses, and pressure sores. Rotate shoes so they can dry out between wears, which also helps reduce fungal risk. Wear clean, dry socks each day, and change them more often if your feet sweat. Moisture-wicking materials can help keep the skin drier. Finally, nail care and professional support can prevent avoidable trouble. Trim toenails straight across to reduce ingrown nails. Use clean, sanitized clippers and avoid cutting too close to the skin. If your nails become thick, discolored, or brittle, or if trimming is hard, a podiatrist can help. Regular foot care visits can also address corns, calluses, and structural issues that affect mobility. The bigger picture. Caring for your feet isn't only about avoiding irritation or infection. It's about protecting the ability to walk comfortably, stay active, and live independently. Neglect can lead to pain, reduced mobility, and even social isolation if getting around becomes difficult. A consistent routine, on the other hand, strengthens the foundation of your daily life. It takes only a few minutes, but it can pay you back with comfort, confidence, and stability. Tomorrow morning, before you put on your shoes or slippers, ask yourself, have I given my feet the care they deserve? They carry you through life, and they deserve more than a quick rinse. If you are still watching and finding these lessons useful, please comment number 1 below to let me know you're still here with me. Thank you for your valuable time. Part 2. The groin area is a hidden hotspot for infection. The groin is one of the most overlooked parts of the body when it comes to hygiene, often because it feels awkward to talk about. But for older adults over 70, this sensitive region needs daily care to prevent problems that can affect comfort, confidence, and overall health. The groin is naturally warm and often moist, and when you add skin folds and reduced mobility, it can become a prime location for irritation and infection. Why the groin is vulnerable. The groin area is uniquely susceptible because warmth, moisture, and skin folds create an environment where bacteria, yeast, and fungi can thrive. Aging often adds several risk factors. Reduced flexibility or trouble bending can make it harder to clean and dry thoroughly, leaving moisture trapped. Skin changes matter too. Aging skin becomes thinner, less elastic, and more prone to sagging, creating deeper folds that collect sweat and bacteria. Incontinence, even occasional leakage, introduces additional moisture that can weaken the skin's protective barrier. Chronic conditions can raise risk even further. Diabetes and obesity, for example, create conditions where infections can develop more easily, whether from higher blood sugar or increased skin folds. Clothing and absorbent products can also contribute. Tight underwear, synthetic fabrics, or adult briefs and pads can trap heat and moisture, worsening irritation. These factors can lead to problems that range from mild itching to serious infection. Intertrigo, caused by skin-on-skin friction in moist areas, can result in red, raw, inflamed skin. If it isn't addressed, it can progress to open sores or secondary infection. Fungal rashes such as jock itch or yeast overgrowth can cause persistent itching, burning, and discomfort. In more severe cases, these conditions can lead to painful wounds that make walking, sitting, or sleeping difficult. The consequences of neglect. The warning signs can start quietly. A faint odor, mild redness, or a little discomfort can seem easy to ignore. But if those early signs are dismissed, a small patch of irritation can develop into a weeping rash or open wound that takes weeks to treat, sometimes requiring prescription creams or antibiotics. For older adults with weakened immunity or poor circulation, infection can spread and become more serious. Consider Margaret, an 82-year-old grandmother who prided herself on her independence. She noticed a persistent odor in her groin area, even after bathing. Embarrassed, she assumed it was just part of aging and avoided talking about it. Over time, the odor worsened and itching began. When she finally spoke with a nurse, She learned she had a mild fungal infection caused by trapped moisture in skin folds. With gentle daily cleaning, careful drying, and a zinc-based barrier cream, her symptoms improved within weeks. Later she shared that she hadn't realized how much it affected her mood and energy until she felt comfortable again. A comprehensive groin care routine. Preventing groin issues requires a consistent, gentle approach. Daily cleaning should be a non-negotiable part of your routine, whether or not you shower. Use warm water and a mild, unscented soap. Harsh soaps and scented products can disrupt the skin's balance, causing dryness or irritation. Clean the groin gently, including folds and creases, using your hands or a soft washcloth. Avoid scrubbing, then rinse thoroughly. Thorough drying is just as important as cleaning. Moisture left in folds is one of the main drivers of irritation and infection. Pat the area dry with a clean, soft towel, especially where skin touches skin. If mobility is limited, sitting on a chair and using a hand mirror can help you see and reach the area. A hairdryer on a cool setting, held safely away, can help if towel drying is difficult. The goal is to never leave the area damp. Moisture management can help if dampness returns quickly. A small amount of cornstarch-based powder or a zinc-based barrier cream can reduce friction and absorb moisture. Avoid talc-based powders, which have been linked to health concerns, and avoid heavily scented products that can irritate sensitive skin. Breathable clothing supports skin health, too. Choose loose-fitting, breathable underwear and avoid fabrics that trap heat. Change underwear daily, or more often if you sweat or experience leakage, and make sure it's clean and dry before wearing. If you use briefs or pads, change them frequently and continue the same cleaning and drying steps to prevent moisture buildup. Daily monitoring takes only a few seconds, but it can prevent weeks of discomfort. Look for redness, odor, itching, scaling, or changes in skin texture. If symptoms persist or anything seems unusual, contact a healthcare provider. Doctors and nurses handle these concerns every day, and early treatment can prevent the problem from becoming stubborn and painful. The broader impact. Proper groin care is not about vanity. It's about comfort, dignity, confidence, and the freedom to move without irritation. Discomfort in this area can affect sleep, mobility, and social life, and it can quietly wear down your mood. A simple daily routine can prevent that, helping you feel clean, comfortable, and more like yourself. If you are still watching and finding these lessons useful, please comment number 2 below to let me know you are still watching with me. Thank you for your valuable time. Part 3. The navel area is a hidden pocket that deserves daily care. Now let's turn to a small part of the body that's often ignored because it seems unimportant, the navel or belly button. It's a tiny indentation, a reminder of the umbilical cord, and many people assume a quick shower rinse keeps it clean. But the navel is a recessed warm pocket that can collect sweat, dead skin, lint, soap residue, and dirt. If it isn't cleaned intentionally, it can become a place where bacteria and yeast thrive, especially for seniors over 70. Why the navel matters more than you think. The navel structure makes it easy for debris and moisture to get trapped. For older adults, several factors increase vulnerability. Skin around the abdomen can become looser, and the navel can become deeper or more folded, which makes buildup more likely. Aging also weakens the immune system, so the body may struggle to control even a small infection. Mobility challenges can make it harder to reach the area, leading to unintentional neglect. Health conditions such as diabetes or obesity can raise risk in warm, moist areas like this one. A history of abdominal surgery or past piercings can also create scar tissue or small spaces where bacteria can hide. The subtle warning signs. Problems in the navel often begin quietly. A musty odor may be the first clue. Mild redness, itchiness, dampness, a sticky feeling, or a small amount of discharge can be easy to dismiss. But these can signal that bacteria or yeast are building up. If ignored, this can progress into omphalitis, an infection or inflammation of the navel. In older adults, it can take longer to heal because skin regeneration is slower and immune responses are weaker. A real-life example, Peter's story. Peter was a 79-year-old retiree known for being meticulous. He showered daily, stayed well-groomed, and took pride in his appearance. Yet he developed a persistent itch around his navel and blamed dry skin or irritation from his waistband. Over time, the itch worsened, and his daughter noticed a faint musty odor while helping him dress. A doctor's visit revealed a yeast infection caused by moisture and buildup that had been missed for months. Peter's experience shows how easy it is to overlook this small area, even when you feel you're doing everything right. Why the navel matters more after 70. Skin becomes thinner and less elastic with age, which can increase moisture retention in recessed areas. The navel can deepen as abdominal muscles weaken, trapping more debris. Seniors with diabetes, obesity, or limited mobility face higher risk, and long periods of sitting or tight clothing can worsen moisture buildup. Reduced flexibility or arthritis can make thorough cleaning harder, so the area may be skipped without realizing it. How to care for your navel, a step-by-step guide. Proper navel care is quick, but it does require intention. During your daily bath or sponge wash, clean gently but thoroughly. Use a cotton swab, the corner of a soft washcloth, or a clean fingertip with warm water and mild fragrance-free soap. Gently swab inside the navel to remove lint, sweat, and debris, rotating carefully. Avoid digging too deeply or scrubbing aggressively, because the skin can be delicate. After cleaning, rinse with a clean damp cloth to remove any soap residue, since leftover soap can irritate. Then dry meticulously with a clean cotton pad, tissue, or the corner of a towel. Even a small amount of moisture can invite microbial growth. For deeper navels, a hairdryer on a cool, low setting held safely away can help dry the area completely. For warning signs. The navel should feel clean, dry, and not sore. If you notice redness, swelling, discharge, strong odor, or persistent discomfort, contact a healthcare provider promptly. Early action can prevent a minor issue from turning into a stubborn infection. Adjust for deeper navels. If your navel is deep or folded, which is common with age or higher body weight, you may need to clean it more than once a day in hot or humid weather. Breathable, loose clothing can also help reduce moisture and friction. Never ignore pain or discharge. Pain, swelling, or foul-smelling or discolored discharge can signal infection that needs medical attention. If you have diabetes, poor circulation, or a history of abdominal surgery or piercings, the risk of complications can be higher, so don't wait for it to pass on its own. The bigger picture, why navel care matters. Think of the navel like a small hidden corner in your home. You may not notice it every day, but if it's never cleaned, debris builds up quietly. Over time, that buildup becomes a bigger problem. The same is true here. Daily navel care is a small act of prevention that helps protect your skin and reduce infection risk. It's not about being obsessive. It's about respecting your body and preventing weeks of discomfort and treatment from something that takes less than a minute to address. If you are still watching and finding these lessons useful, please comment number 3 below to let me know you are still watching with me. Thank you for your valuable time. Part 4, Final Thoughts. What these 3 body parts say about your health. The underarms, groin, and navel are more than areas to wash. They can function like early warning zones, quietly showing how your body is handling stress, aging, and microbial imbalance. In your 60s, 70s, 80s, and beyond, paying attention to these areas becomes more important as skin resilience, immunity, and mobility change. Let's recap the key lessons from these 3 areas. The underarms are more than sweat and odor. They are linked with the body's lymphatic system, and buildup of deodorant residue, dead skin, and bacteria can contribute to irritation and inflammation. Gentle daily cleaning helps reduce irritation and supports overall comfort. The groin is where hygiene meets dignity. Heat, moisture, and friction can create a breeding ground for infection, especially for seniors who sit longer, wear tight clothing, or deal with incontinence. Daily cleaning and thorough drying protect skin, improve comfort, and support confidence. The navel is often the most forgotten. This tiny pocket can harbor bacteria and yeast if it isn't cleaned intentionally. A brief daily routine of gentle cleaning and complete drying can help prevent infections like omphalitis and spare you prolonged discomfort or medication. The deeper message is simple: small acts can have a big impact. Aging well isn't only about major treatments or dramatic lifestyle changes. It's often built from small, consistent habits that respect what your body needs now. Taking a few minutes each day to care for these areas can reduce rashes and infections, improve comfort, support confidence, and lower the chances of needing medical intervention. Many seniors who adopt these simple routines feel fresher, sleep better, and move more comfortably because they're no longer dealing with irritation that began in a neglected spot. Thank you for joining us to explore these often overlooked areas that can play a big role in comfort and health as you age. What surprised you most today? Maybe it was the importance of drying between the toes, caring for the groin gently, or paying attention to the navel. Share one thing you learned and plan to do, and if this video helped you, please like, share, and subscribe for more practical tips to help you feel your best at any age.